right, perfect. Today I'm joined by Cheryl Reinking, Chief Nursing Officer at El Camino Health. Cheryl has spent over 3 decades with the same organization, starting as a bedside nurse and rising to lead more than 2,000 nurses and staff. And under her leadership, El Camino Health has achieved multiple magnet designations, one of the highest honors in nursing excellence. So today we're going to go deeper than the surface. We're going to talk about what actually makes this hospital different for nurses, why nurses stay or leave, and how to know if you're in the right place or if it's time to move on. Cheryl, welcome to the show.
Thank you for having me.
Oh, thanks for joining. Cheryl, you've spent over 30 years at El Camino Health, which is honestly rare in today's environment. What made you stay and what kept you growing instead of feeling stuck?
Well, clearly, I love El Camino Health. And I've spent most of my career here because it's really about the people I work with and their dedication to patient-centered care and excellence in nursing. And that is truly the reason I stay. I feel that I'm blessed to work amongst people who put the patient in the middle with every single decision.
Absolutely. Such an important perspective, especially right now. So I know you started as a bedside nurse. What are some of the pivotal moments that shaped how you lead today?
Yes, I started, as you said, over 30 years ago now as a bedside nurse on the night shift in med-surg orthopedics. And it was those opportunities that were afforded me as a bedside nurse to learn and grow and be mentored by other nurses and leaders in nursing at El Camino Health. And understanding those aspects of providing the highest quality of care and also having a work environment where I was actually allowed and it was permitted and in fact promoted for me to have those opportunities to grow and develop at the bedside and then to become a leader and then continue up the trajectory here at El Camino to become the chief nurse.
That's amazing. And I love that you started in med surg. I think we have a lot in our audience who are starting in med surg as well. So thanks for sharing that. And I think a lot of nurses assume leadership just happens, but these moments you're describing really do matter. So tell me, what do you think newer nurses misunderstand about building a long-term career in one organization?
Yes, I think that our new nurses hopefully are beginning to see the importance of the relationships they can build and the importance of developing those mentors in their organizations and really going deep and learning about their organizations and how their career trajectory can very much depend on the relationships that they develop and all of the opportunities to learn and grow both clinically and their leadership skills. I know here at El Camino Health, we certainly encourage our new nurses to take advantage of those opportunities for our mentorship program and in the relationships they build with each other and their leaders to want to stay here and grow here at El Camino Health in their careers. And we have opportunities for them to do that.
That's fantastic. I think that mentorship aspect is really important. If you could go back to your first year as a nurse, knowing what you know now, what would you do differently?
I believe that probably I would um, have tried to get on day shift sooner because I sure lost a lot of sleep on that night shift. I can remember struggling with that, but it was still a great experience. I was just mostly kidding about that, but certainly taking the advantage of learning as much as I could, honestly. At that age, I was probably not, wasn't necessarily a focus of learning as much as I could clinically and tapping into all the different resources that there were available. There's certainly a lot more now than there were in 1988 to the resources available, the information available to really become an expert more quickly than I did.
Okay, very good. Well, let's shift into something every nurse listening is thinking about. There are a lot of hospitals that say they support nurses, but nurses know there's a difference between what's said sometimes and what's actually experienced. So El Camino has achieved multiple magnet designations. What does that actually look like for a nurse on the floor day to day?
Yeah, earning our fifth designation, it really recognizes our culture, doesn't it? And that culture of excellence that's here at El Camino Health, and really highlighting the hard work of our nurses in achieving that level of performance. But for nurses every day, it's having the tools and the resources so that they can provide the care that our patients are seeking at the highest levels. And that we must create a work environment where they can do that.
Absolutely. Well, what does El Camino do differently, excuse me, that a nurse would feel almost immediately after starting?
I think that it's certainly the onboarding program we have here is really fantastic. We have a week-long orientation program, even with our travelers. And that's something our travelers tell us, really, we get the same amount of training as every new nurse hire? Yes, we want everyone to get the same training and onboarding at every nurse, at every level, so that they understand our policies, our procedures, the expectations, the standards of care. So it starts from the moment they start here at El Camino, is really the onboarding process to ensure that they know how valued they are, all the way up through their preceptorship and ensuring their preceptors are well trained. We have preceptor workshops. There's expectations related to our preceptors so that those joining our workforce feel that they have the best possible opportunity to be successful. We ensure that managers are doing frequent check-ins to ensure our staff feel that they're have the tools they need to perform at the highest levels.
Amazing. I think that support system is really
Mhm.
important. If I were a nurse in my first 30 to 60 days there, what tells me I made the right decision?
Yes, I think it's the support of your peers and your team members, of course, the support of your leaders, and the attention to patient care. We have many structures and processes here to ensure the highest level of safety through our tiered safety huddles. We ensure that our managers are supported and that they can have issues escalated, not just through nursing, but through the other departments, so that staff feel that the concerns that they elevated are addressed as quickly as possible. And we ensure the structures are here for that. And nurses really care about that. Nurses want to ensure that their patients are able to get the highest level of care and that care is patient-centered. And if we don't give them the tools to do that and create those structures and processes, then we aren't we're not doing ourselves any favor, our patients or our staff. Of course, we have other structures in place, such as shared governance. So a new nurse here, while they may not be immediately in our shared governance process, they certainly learn about it and that they know they have a voice and there's someone representing them at their nursing council so that their voices can be heard. Again, essential for nurses to feel they belong.
Absolutely. Thank you for sharing that. So I want to shift to what are some of the non-obvious benefits, things nurses don't realize until they're already part of the organization?
That's a great question. So non-obvious benefits until they're part of the organization, probably, uh, you know, the great food in our cafeteria. You
Oh,
know, there's things like that. We have a lot of recognition that we do here at El Camino Health that maybe you didn't know when you signed up to work here. Tonight, in fact, I'm coming in to provide night shift nibbles. So for the night shift who work here, about once a quarter, we executives and others come in and provide nibbles, some kind of treat or sandwiches to our night shift to say thank you. You're valued. And I think, sometimes nurses or other staff don't realize that we're doing that. And then they're surprised and so grateful. And we want to show our gratitude to them through being able to do these little things just to say thank you.
absolutely. And it's always the little things that really do make a difference. That's a great program. Well, now let's talk about something that's impacting every healthcare system right now, and that's nurse retention. So, in your experience, what really makes nurses stay and what causes them to leave, even in a strong organization like yours?
We've really examined that at El Camino Health, and there was a period of time in which we had the highest turnover rate that we'd ever had, like many organizations across the country. At one point, just at the tail end of the pandemic in 2022, our turnover rate went up to 12.7. It had never been that high in all the years I've been here. It was really concerning, and we really wanted to learn why were people leaving. And of course, we learned that people were re-examining their lives during the pandemic and where they wanted to be. But we also learned that nurses wanted opportunities to grow and be promoted within the organization. And so what we did is we brought in a nurse retention specialist. I was able to get a foundation funded grant to bring in a nurse who had a management background, but also a really great outgoing personality. Her name's Amanda, I was able to hire and bring in to create a nurse retention program. And she's done a fabulous job in creating initiatives to ensure we're able to keep our nurses here. And there are some things that she's done that we saw as very important from the very beginning, and that is creating these career pathways for new nurses so that they know where they're going here at El Camino Health. And if they have a dream to come in as a med-surg nurse, as we talked about before, but become a critical care nurse, Amanda helps set them up with a plan over the next 3 to 5 years to know what they need to do each year to learn and grow to reach their goal and their dream of becoming a critical care nurse. And we've seen that happen over and over again. And we're seeing much fewer people leave because of promotion opportunities or learning a different specialty opportunity. And we're back down to around 5% in our turnover rate. There are many other strategies that we've put into place, like ensuring we have a really solid clinical ladder. So nurses at the bedside have an opportunity to grow and develop within the clinical ladder program. We're also doing staff experience interviews. So managers spent more time just learning from our staff and what's going well, where do we have opportunities, and taking that data and trending it so we can learn more about how do we keep El Camino Health nurses here and to stay with us. Does that help give you a
Fantastic.
few ideas about what we're doing?
Yes, no, that's really exciting that you hired a retention specialist. I think that had to make a huge difference. Really, really some good strategies there. So we've talked a lot about all the different things that El Camino is currently doing for their nurses, but how do you ensure nurses feel seen and valued, not just scheduled and staffed?
I think that's so important that you talk about that. And, through our different recognition programs, we're able to do that. We have annual nurse awards where we nominate and select nurses. We have Daisy Awards every month where patients and families honor nurses. So the recognition and getting the nurses and their great, amazing work that they do with our patients every day highlighted within our organization is so key. But also having those structures in place for nurses to be involved. We have so many shared governance opportunities here at the unit level, and then at a more centralized level, but also in the performance improvement areas. We have direct care nurses who are sitting on our skin integrity team, who are sitting on our falls prevention team, and we have a new council that we're really excited about, our sustainability team. And the nurses are loving the opportunity to make our healthcare organization be more sustainable and use products judiciously. And that's been, I've been surprised myself at how popular that has been. And they just had a fair last week where they showcased all of the sustainability initiatives that they've done. And it was just fantastic and so much energy and enthusiasm. So anytime we can get nurses out and participating in something they're passionate about and highlighting that within our organization, that's key to ensure their voices are heard, that their talents, their many talents, are highlighted across the organization.
Love that. Well, that's amazing. And we've been talking a lot about how El Camino and you are building a culture there that nurses are really, it really resonates with them. And we know that that just doesn't happen. So tell me, how do you develop and hold nurse leaders accountable for the culture of their units?
Yeah, so nurse leader development is really key. We do have a clinical manager council, so they have their own shared governance council. We have educational program. We do also really important training for them on relationship-based care. And then, of course, we have accountability built in on particularly as it relates to outcomes and achieving certain patient outcome goals and patient experience goals and financial goals. We have goals just like every other organization, but what I like to think is that they have a lot of support to get the needed assistance to really understand their data through our process improvement team, through our quality team, and then have the help to implement potentially evidence-based practice changes and the support they need on their units to audit to ensure that we're able to together meet our goals.
Excellent. Well, thank you for that. I'm curious, how do you balance operational demands with protecting nurse well-being?
Yeah, that's a challenge for all of us, isn't it? And I think one of the things that has been particularly difficult for nurses across the country is nurse workplace violence. And that's something that we've really been focused on here at El Camino Health and trying to ensure that our nurses have systems in place to protect them. And we've created a new team called the Calm Team, which is a team that is made up of some of the peers on their units who have had extra training on trauma-informed care and de-escalation, so that when we do see a patient who's escalating in their behavior, we're able to bring a team together, including some members of the team on the unit and some mental health professionals, to create a care plan and some active interventions to ensure the patient's behavior doesn't get out of control. That's been a really important effort to ensure our patients stay safe, which nurses actually relate to their well-being. In addition to the Calm Team, there are other well-being kinds of things we've done. We have an employee support specialist who's a mental health professional who is able to come and provide support right at the bedside or at the unit side, really, for our staff who have gone through a workplace violence event or who may have been involved in an error or a patient death that's really cost a lot of emotion. And so this mental health professional is able to take that healthcare worker away for just a few minutes and do that initial debriefing. Because we know that when staff go home with those feelings, that it can really lead to some permanent kind of harm mentally, particularly PTSD. So we want to deal with it as soon as we can at the time of the event and provide that support right then and there with our employee support specialist. Our employee support specialist has also done some of her own sort of little meditation recordings that she's put on our intranet, so people can listen to that when they feel they just need to take it down a notch, take a pause, and work on their own well-being during their shift. And it's been really helpful to have that additional support.
Absolutely. It's great to hear that you're taking those extra steps to really provide that support level for your nurses. That really makes a difference. So I'm curious if I asked your nurses off the record how they would describe the culture, what do you think they would say?
Yeah. Well, I'd like to say, I'd like to think that they would say that the culture here is one of a supportive culture where patients are at the center of everything, but that nurses have the support they need to provide the care that they dream of providing. You know, when you come out of nursing school, you have a certain idea of the care you're able to provide. And I know some nurses don't necessarily feel they've been able to meet that. And we want to elevate those important dreams that our new nurses have and provide them that support so they do want to stay with us. I do have to say, our new nurses, we have a 92% retention rate for our new grads. So I'd like to think that that's because we've provided them the support that they dreamt of when they're in nursing school, and that they're able to provide the kind of care that they believed that they were trained to do. So that's really what I'd hope they'd say, that we have that culture here.
Amazing. Thank you for sharing that. So let's look ahead for a moment. What innovations or changes are you most excited about that will impact nurses over the next few years?
Well, you just can't have a podcast without talking about AI, can you?
No, you can't.
So, here at El Camino Health, we're in the heart of Silicon Valley. And so we're really looking at how can we use technology to support the nurse. And some of that may include AI. And we're trying to look at what our electronic health record provides us. And how can we take away these kind of tasks that nurses must do with our systems, our computer systems, and give them more time back at the bedside. We've been measuring clicks and things like that, but honestly, I think AI could change things even more. If nurses had more condensed information provided to them, served up to them, I should say, in a way they could take action on quickly, I think that'll be a game changer. And I think we're very, very close to that. We're not quite there yet, but also ambient listening is something I'm really looking forward to implementing here so that nurses aren't having these conversations with patients and families and doing all of their exams and then needing to go feed it into the computer system. Wouldn't it be fantastic if it just did it for you? And then you have to have the human in the loop. You have to check it, of course, but it just feels like it's more of a one-step process than a multiple-step process. So I'm really excited of what's right on the edge in technology right now. We're getting close. And here at El Camino, we like to be early adopters of new technology. We were one of the first in the country, maybe the world, to have an electronic health record in 1971. So it's something our nurses expect. and something they're not really afraid of, to be honest. They want to try new things. And so I'm really excited about what these new technologies and embedding AI where appropriate can take
Yeah.
us so that nurses, again, have more time to spend with what they do best, and that is providing care to our patients.
Absolutely. And I think I'd love to hear that a hospital health system is adopting innovative solutions to support nurses. That's really important. So, we've talked a little bit about your newer nurses and your great retention rate, but how is El Camino adapting to what newer nurses expect from their careers today?
Yes. So, we talk a lot about the generational differences, and that's something we've paid a lot of attention to at El Camino. In fact, our nurse retention specialist has made it her goal to ensure that we really are competent about the generations of nurses that we have and what their needs are, because every generation has something a little bit different that they focus on. And we know our new nurses coming out of school, Gen Zs, as we call them, are looking for those opportunities to grow and develop and understand where their career is going. And so we want to ensure that we create those opportunities for them and create that pathway for them. And that's why our nurse retention specialists, our managers are being kind of instructed on how important that is to this generation and ensure that we're opening those doors, providing those opportunities for this particular group. Well, really all of our groups, but we know this group in particular really wants to get there and maybe more quickly than generations before.
Very true. And that's a great point. Well, thinking about recruitment, who is the ideal nurse for El Camino?
Yes. Oh, that's such a great question. Thank you. We are really looking for nurses who put the patients first. We show our nurses during recruitment opportunities our practice model. And we say, what does this mean to you? And our practice model has the patient at the middle, has some other words associated with it. And we're looking for nurses who really indicate that they do put patients in the middle, that every decision is about ensuring our patients have the highest level of care and the greatest experience here at El Camino Health. So we look for certain words. We look for maturity. We look for curiosity, and also, grounded in science. So that's what I feel that our nurses are going to be successful here, have those attributes.
Excellent. And I appreciate you sharing that. Well, Cheryl, we're coming towards the end of our podcast today, but I do want to ask you a final question. If a nurse is listening right now and considering making a move, what would you want them to know before they apply?
Well, I'd want them to know that here at El Camino Health, nurses are known and have a reputation here at El Camino Health as providing the highest level, most compassionate care, and that you would be given the support and the tools you need to be able to deliver on that promise.
Excellent. Well, Cheryl, this has been such a valuable conversation, especially for nurses who are trying to figure out their next step that are in your area. Because the reality is, not every nurse needs to leave, but not every nurse should stay where they're at currently. So El Camino might be an amazing choice for them. And I just appreciate you going through all of this information with me today.
It was my pleasure. I'm always happy to talk about nursing and our profession.
Thank you for listening to this week's episode of Nursing Matters Daily Dose. Are you interested in more career resources? Then hop on over to the RN Network at rnnet.org. Also, while you're at it, hit that like and subscribe button and share this episode with one nurse who really needs to hear it. Thanks so much, and we'll see you next time.